Good afternoon, everyone, and welcome to the CHS O'Brien Seminar Series. This afternoon's seminar is entitled Using Tableau to Examine Public Health Research in Canada and the Role of the O'Brien Institute. Before we begin our webinar today, I would like to take this opportunity to acknowledge the traditional territories of the people of Treaty 7 region in southern Alberta, which includes the Blackfoot Confederacy, comprising the Siksika, Piikani, and Kainai First Nations, as well as the Tsuut'ina First Nation and the Stoney Nakoda, including Chiniki, Bearspaw, and Wesley First Nations. The city of Calgary is also home to Métis Nation of Alberta Region 3. My name is Diane Lorenzetti. I'm a member of the O'Brien Institute, and I'm very happy to welcome everyone to today's presentation. I'd like to take a moment to introduce our speaker for the afternoon. Justin Bisal is the Lead Statistical Analyst in the Office of Faculty Development and Performance. In his current role, Justin utilizes data visualization software to explore public and private data to examine research-related activity in higher education. So he's the perfect person to lead today's discussion. A couple of housekeeping items. We have a Q&A box for today's session, and if you have any questions, we invite you to use the Q&A box to enter those questions. I will be monitoring the box throughout the presentation, and so if there are any questions that you would like to ask of the speaker, please feel free to enter them, and we may choose to address them during the presentation or in the few minutes that we will have after the presentation ends. The webinar will be recorded, but if attendees have follow-up questions, they may contact the iph@ucalgary.ca. Just wanted to let everybody know, if we run out of time to address all of your questions, we will be able to share any outstanding questions, including the question inquirer's name and email address with the speaker following the session. So don't worry if your question isn't answered in the moment. We will absolutely get around to answering the question either in the session or immediately afterwards. And without further ado, I will hand the session off to our speaker, Justin.
Thank you, Diane. I'm pleased to represent the Office of Faculty Development and Performance with the Cummings School of Medicine. We do research-related reporting on the CSM institutes and departments and various research groups throughout the university. And Diane came up with a proposal to do a presentation to this group and suggested some very beneficial domains of analysis that we've incorporated into this report, and we'll be incorporating it into other reports. So hopefully you guys enjoy this presentation, and if you guys have any questions, hopefully we can get to it after we're done, and if not, feel free to give me an email or contact Diane. Okay, so starting with a high-level view, what we've done is we've conducted some analysis using the Web of Science Core Collection publication database to sort of categorize research activity by institution, and then further break down by faculty and by department. So from a high level view, this is just unique publications, but what you can do is you can filter for a specific topic. So in this instance, we'll search for public health So what this does is it looks at a publication record and it searches for whatever terms you entered. Generally, like you're looking at the title and the abstract and the keywords and a few of those fields. So if you look at previously, it was 7.5%. So for public health, the piece of the pie for Calgary is 8.6%. You can drill down and you can see out of that 8.86%, the majority is 63 of the publications are from the university and 10 aren't. And remember, this is just in 1 year. And then you can drill down and you can see out of the UCalgary total, 11 were by members of the program, Community Health Sciences. 38 were by members of the O'Brien Institute, and 37 by other UCalgary faculty. So you can drill down and say, for instance, if you wanted to know the other UCalgary faculty who are publishing in public health, here you can see a bubble plot. And you can see the different faculties that are represented. You can drill down and view the papers. And you can actually drill down and view the article. So somewhere in this article, it's going to be, say, public health. So that was one sort of purpose of this presentation, is like, this is like using a software that is called Tableau, and there's other versions or alternative platforms out there like Power BI and D3 JavaScript. It's sort of like a self-service analytics that allows you to do interactive visualizations. And this sort of approach to doing an analytical presentation, it might be a little unusual. So that's what we were trying to show here. There's many different ways to show this type of information, and this is one way that might be beneficial. So I guess we can try another topic, like let's try public health and or any, Diane, do you have any suggestions? Maybe to widen the lens?
So there was a question that came through the Q&A, Justin, about whether or not when you're running these visualizations, did you allocate all authors to a particular university or specific authors?
Okay, so the way it works is, let's actually just show the data itself. So right now it's by city, right? So it's looking at the city of Calgary, not the University of Calgary. And then we do the drill down, non-UCalgary, UCalgary. So if we just go down to the article itself. So this is Keith Yates, right? We'll pull up a paper. So you can see there's all these people. And so it's like, it's a record for each person. And we're kind of, so then like the people that are from Calgary, those are the ones that we include within Calgary. And then some of these folks, like it might say like Toronto or something like that, and they would be the ones on the in the other locations in the map. So yeah, you can really widen the lens. Like if you wanted to look for public health or, like cardiovascular, or maybe exercise, right? That's exercise. Yeah, so if you, depending on your terms, like you can probably imagine, right? If you type in something like oil and gas, like the Alberta totals are going to be a little bit higher. Yeah. Okay. So anyways, this is a quick visual that we wanted to show to, if you want to pick a topic and see sort of the context of which Calgary and the O'Brien Institute and the O'Brien graduate students see their sort of their place in context with the rest of Canada. This is one method of doing that. We'll move on to another dashboard that we've composed, and it's pretty useful for something like the Community Health Sciences or the O'Brien Institute, units that do lots of collaboration with other units. So what this view shows is what it does basically is it examines the Web of Science core collection database over the last 5 years for co-authorship, basically defining interdisciplinary collaboration as co-authorship between two authors. If it's within a faculty, it's one type of discipline. If it's, two different faculties, it's another type. So these totals that you'll see, those are called the collaborations, right? So what this shows is a breakdown externally of the other faculties that a group collaborates with, a breakdown of external co-authors, a breakdown internally, and you got the keywords that will tell you information about the collaborative research. So we'll show an example, pick a faculty, and then, so what we'll do is we'll filter for co-authors that are outside of the faculty. So for CSM, you have a breakdown externally of the other faculties that you've collaborated with. You can drill down and then pick a faculty. So for arts, here's a breakdown internally of the people from CSM who've collaborated with arts. Here's a breakdown of arts faculty who've collaborated with CSM. This is a word cloud of author keywords that show you sort of the terms that are involved in these CSM and arts collaborations. So you can drill down, like you'll see some, like there's some folks that appear in both sides. So like Tavis Campbell is in arts, but he's also in oncology. So like depending on the way you look at it, if you're part of two faculties and I collaborate with you, technically I'm collaborating with two different faculties in this definition at least. So if you see something interesting like Linda Carlson, you can drill down by clicking her name and see the top internal authors who've collaborated with her. So then you can drill down if you want to see the collaborations between Linda Carlson and Michael Specka. These are the keywords. You can, really kind of go down to the source of the information that feeds all the visuals in the form of a table of publications. So you can see if you click the article, it'll have all the criteria that you selected in your filter actions. So
Justin, we've had a couple of structural or process questions that might be useful to address at this point. One question is about the updating of this data. So is it automatically being updated on an ongoing basis, or are there certain times of the year where updates are loaded into the system?
So Tableau is meant to be, I guess it can accommodate both manual updating or automatic updating. It's meant for sort of enterprise level infrastructure. So if you're with IT, you can kind of plug it in with the infrastructure and do that automatic updating. But with the level of sort of access that our office has, we generally just do annual updates. And kind of the work that we do in our office is that we connect sort of disparate databases into a centralized reporting system. So we try to do it as automated as possible, but for something like publications, we just do it probably annually or maybe twice a year.
One other question, how far back in time are the data that form the basis for these visualizations?
So in this instance, we're analyzing collaboration of current faculty. So we're only going back 5 years for publications with an address of Calgary. You could go back further, you can go back less years, like it depends on, I guess, how accurate you want it to be. A collaboration from 7 years ago, is it still valid 2 years ago or today? It's hard to say. But right now, 5 years, it seemed pretty reasonable.
Great, thank you.
So I'll show another example. So with this project, what we did is we took the group of students in the community health sciences faculty. And we basically just treated it like another department or another faculty. So I'm going to select the graduate students right here. So you can see the performance has slowed down quite a bit. Okay, so for the community health science students, basically, here is a breakdown internally. Here's a breakdown externally of the faculties that you've collaborated with. I'm just going to make sure I deselect. Yeah, okay. So, and here's a breakdown of external co-authors, and here's the work class. So same type of thing as before. You can see a lot of these folks are also faculty members. Depending on the way you want to do this analysis, do you want to include sort of graduates who become faculty members or not? It depends. And so same type of analysis. If you see something interesting, like let's filter for non-CSM collaborations. Actually, you know what? We've already done this before. I'll show you something else. So this is what it looks like for the students in community health sciences. We'll go back and select for CSM. So another cool thing you can do with this is you can select for impact factor. So you can filter for journals that have a minimum impact factor. As well, you can filter for a specific topic. So the same type of thing that we had done previously, like if there's, you know, a certain field that you want to kind of measure or visualize the collaboration on, you can do that. So within the topic of public health, this is what the collaboration looks like for CSM externally with other faculties. So, and another cool thing that you can do actually. So there's a filter for authorship role. So it's, you can filter for first or last author. So when it comes to collaboration, this is actually kind of interesting because like if you're the senior author on a paper, then all the collaboration metrics off of that are sort of based on choices that you had more authority on. And so you can you can do some cool analysis on like if a CSM author is the senior person on a paper, how likely are they going to have a non-CSM co-author and vice versa, sort of like sharing metrics if you wanted to. So there's a lot of really useful information in this dashboard. And it's not just CSM, you can do other faculties, and we'll be generating versions of this for the institutes as well. So stay tuned. So we'll show something else. So basically that's kind of a new dashboard on collaboration. So in the meantime, I'm looking at a couple questions here. I see one like, what are the benefits of using Tableau in comparison to other software options? There's strengths and weaknesses with every different platform. I guess generally with Tableau, I would say it's generally a little bit easier to learn. And it's a little bit, they're pretty powerful with their visualizations, like in terms of the speed and the back engine with the database. And it's pretty easy to get things up and running. But there's like D3 JavaScript is a lot more of a strict learning curve, but it's a lot more powerful. And Power BI has its own pluses and minuses as well. So here's another visual right here. This is author keywords. So basically what we're doing is we're taking publications over the last 5 years and we're showing a word cloud of the author keywords for papers with an O'Brien author. So what you can do, so within the O'Brien Institute, these are the main author keywords. So you can drill down if you see something interesting, you know, epidemiology. So if you said, if this is a major like research priority within O'Brien, you can click on it and then see a bubble plot of the UCalgary folks who've published in that field. So here you see the O'Brien people, here you see the non-O'Brien people. So generally, like I'm assuming that if you saw a big green bubble here, then maybe that would be a candidate to investigate for maybe for recruitment or collaboration and that type of stuff. So if you want to drill down, so what you'll see is these are the top UCalgary epidemiology papers. These are the top selected persons, top epidemiology papers. You can do the usual read the paper. So another cool thing about this dashboard is I'm going to reset the filters. So you can filter for author roles as well. So like you can really refine something like a sort of a qualitative visual like this. You can really refine it and get value out of it if you can filter for impact factor. So, And generally, it seems like the terms that we had saw before hold the same weight, I guess. So let's try within public health and see what that looks like. So within the sort of umbrella topic of public health, for senior author papers with an impact factor at least 4, this is what it looks like for O'Brien. Looks like the others, the number of articles are pretty small, so it's a little bit skewed. So I'll show what it looks like for the students as well. This is something that we recently added. So you have a department. I'm going to select for community health sciences. So within the program of community health sciences, students who have authored papers show the following author keyword word cloud. So then same thing, click on a term. These are the people. The authorship role filter might actually be pretty useful in this instance. So for the folks who came from the program who are senior authors under the key term pregnancy, these are the O'Brien, or sorry, the community health science people. You can drill down and do the usual, I guess, so it's pregnancy that we're looking at, and Dr. Metcalf should be the first or last author. So I'm just looking at some more questions here. So how do we assign membership? So this is based on, membership is based on what we get sent quarterly from the institutes. And if you mean membership as in like department and faculty, that's based off of their appointment. So it's not based off their paper. We use the information on the paper to tell who you are, but there's so much variation with how people spell stuff in papers that we go with internal data sources. So look at another question here. Okay, yeah, good question. Does this track only journal publications or other types? So we have multiple databases, and what this particular dashboard, the database that it uses specific document types: article, case report, clinical trial, editorial, and review. So basically, it's not going to include abstracts, conference papers, posters, stuff like that. So what we have here is a map showing the global collaborations of O'Brien. You've seen it's a familiar process. You see something interesting, you click on it, you drill down. Like for China, here's a bubble plot of UCalgary collaborators. So O'Brien folks are blue, or pink, and so it's not really going to tell you that much right now. But if you add the additional filters, so if you say for instance, if maybe there's a delegate from a certain country who's a visitor and you want to see internally at the O'Brien Institute, what partnerships do we have that are strong with this particular country? So I would say a strong partnership would be if you have a senior author on a paper that has a co-author from another country, then like there should be some sort of a strong relationship there. So if you look at Saudi Arabia here, so for senior authors, these are the top UCalgary folks who've collaborated with that country. So same type of deal. So yeah, so there's two colors for Dr. Metcalf because she is, what is the reason why? Okay, so it's, I guess she was a student as well. I'm going to, should be. So not sure what's going on there, but generally same thing that we had done before. We should see senior author paper somewhere. One of these co-authors should be from Saudi Arabia, this person. So there's different approaches to doing dashboarding. The approach that we've kind of used quite frequently is sort of the drill down approach. So you start with an aggregate analysis and you just kind of provide a flow down to the original source of information. So it's really nice working with public data sets. If they're friendly and easy to access, then you can do stuff that we just showed you where you can link to the original document. So I'll look at another question here. Have we seen an uptake? Definitely. I'll show you some information afterwards. Like in terms of self-service analytics, this used to be something that would require like a real sort of emphasis from an organization. Like you need IT and you need a lot of support, like you need databases, and nowadays with the cloud and with like you have a lot of platforms now, they have their own cloud service. So like you can do like Amazon Web Service where you can store your data there, you can use all your machine learning and algorithms and stuff like that, all your computational power can be done from them and you just pay a little service. And that's kind of a direction that Tableau is going in as well. A little bit different, obviously, but the benefit is the end user can do cool dashboards for very, very low startup cost. If you're a student or if you're an individual, it's actually free. I can show you how to do that. If you're interested in another dashboard platform like Power BI or you can use Python and R and D3 JavaScript, there's plenty of resources online. So there's another dashboard that we composed here. So this is supposed to be for folks to get an idea of the sort of research topics that individuals are involved in. So if there's like, say, if there's like a grant opportunity in arthritis research, so you can see a breakdown of faculty who've, I guess starting right now, we have a filter for O'Brien. So we would find out who from O'Brien has published in that area. So the top O'Brien person in arthritis is Cheryl Barnaby. So then, you can refine your filter. Like say if you wanted osteoarthritis and not rheumatoid arthritis, or if you want to sort by time cited, or do the usual authorship role filters, you can do all that. So this will sort of narrow the list down, but when you need to inspect things closer. So that's another benefit of these dashboards. It's not just a PDF that you're looking at. You can really drill down and see, okay, Deborah Marshall, we selected arthritis. She came up. Is she really within, the arthritis bucket that we're looking for? And you can see her collaborators throughout the university. You can see, her global collaborators. You can see a list of her papers. So yeah, so we selected arthritis. So which ones of these papers are arthritis? You can see this one's false. So it's interesting, like you look at that, and maybe if you understand arthritis research and this one is within the arthritis category, then this tells you maybe you should modify your search terms a little bit. So anyways, that's what this page does. And we've just about wrapped up. We're getting a little close to, Diane, what time do we need to cut off here?
I think we have a bit more time. There are some outstanding questions as well that we can address.
Okay, I'll go through. Yeah, so I'm reading like how long does it take to do some of this stuff? Generally, this is something that is a misconception when it comes to these dashboards, is that the value from the user is perceived in the dashboard, in the visuals, all these cool, things that you click on and all these interactions and stuff. But the time, like 80% of the time is in the data prep. And these like Tableau is a cool software where you can make these dashboards really, really easily, but you have to have good quality, clean, structured data. And that's where the most of the time spent. And it's not just with dashboarding. Like if you do other sorts of analytics projects, data prep is always going to take most of the time. But if you have clean data, then it shouldn't take you very long at all. And
so there's a couple.
Sorry, Diane, go ahead.
So I was going to say there's a couple of questions around around how these dashboards and how Tableau more generally has been used, like what some of the opportunities are in terms of advancing research or other applications.
Yeah, I think this might be a good opportunity. So I just clicked, there's a sort of a blog on Tableau that they have different types of visuals. You'll see the same thing if you go to like Power BI or D3 JavaScript. So you can get an idea of what other people are doing with the software. And because this is like, kind of an art as well as a science, you really get some good ideas. And so there's like fun analysis that people do. Like, if you can be an expert on anything. You can, if you're an expert on a certain band, you can make a dashboard about their songs, and people do all kinds of really, really cool stuff. But they've actually, with the whole COVID-19 situation, they've added sort of a page that shows the really cool visuals that people have been doing with that. So we can, feel free, you should definitely, if you're interested in this stuff, check this page out, because there's a lot of cool stuff that I can't even start to go through right now. And so, Okay, so like Tableau at the university, if you go to business, like if you go to ServiceNow, business intelligence, they have, um, they'll steer you in the right, like the same place where you go to like get your computer restarted or reformatted, that's the place to go. So as well, you can, there's Tableau Desktop, Tableau Professional, but there's Tableau Open as well. It's free. So, and you can publish it online. If you have secret information, obviously you can't be using that platform, but it's great if you just want to explore the software and, you know, if you're interested, like if you like sports and you want to do visuals on your favorite team, it's a free way to get your hands dirty with some interesting data. So just go to tableau.com and feel free to check it out. And I can't see that many more questions. There's not that many more relevant sections, at least when it comes to the sections that have student info. Diane, do you have any ideas of anything else that might be interesting?
I just popped a link into chat to a web page that was created by the library on data visualization. So that includes some links and some additional information and learning.
Yeah, there's a lot of people throughout the university that are doing work in this field. And I know we've gotten a lot of help just by asking around. And if you're interested, there's plenty of resources. So I think being at the university, it's a good opportunity. Oh, I see some more questions. Okay. Oh, these have been answered. Yeah, I see a question. What are the main limitations of Tableau? So there's limitations of the analysis and there's limitations of the software, right? Generally, like most of the questions would be data related. The software is just, that's like, you know, I guess a limitation of Tableau is that it doesn't, you have to, it's difficult to do user input. And if like, you can always find a solution to what you're trying to do, but in many instances you have to do a workaround. Whereas if you use a software like JavaScript, you have more control to sort of do whatever you want to do, but it takes a lot longer.
So Justin, there's a new question that was just put into chat about the flowchart.
Okay, Amy, Dr. Melkaf, that's a really good question. And yes, we wanted to actually show the same analysis using Tri-Council records. Never got a chance to kind of incorporate it into this, but if anyone wants to touch base, perhaps sometime in March, we could do a demo with that as well. But we basically, if you think about it, I'm trying to show a publication record here, but like the way this dashboard works, or the section that you guys saw, it looks at a publication record, which just tells you information, and it has the abstract. It's just a bunch of text. So you can do the same thing with a grant record as well. If you think about it, like you have the title, you got the abstract, and so you can do the same sort of analysis if you have a good grasp of your key terms, and you can add additional fields and stuff. You can really sort of narrow down a certain type of funding that's within a research topic. And as well, like there's other sources of data. You can use clinical trials, like maybe patents as well, kind of similar sources of information that that have sort of an abstract type field that allows you to do text searches like this.
So there's a question that just came through again about accessing the Tableau site and how, as a staff person, would be able to get access to Tableau.
I would contact IT. Basically, when it comes to the university, you can publish, like if there's someone who has a desktop license, they can publish data to the server, and then someone can go there and manipulate and kind of maybe not create a full dashboard like this, but something pretty close to that. But if you want to have full control, then you need to purchase Tableau Desktop, which is, I think it's like maybe $800 or $900. So it's not free, but it's not super expensive either. Or like if you're interested, I know Power BI is a lot cheaper, and the university offers like a decent amount of support for that. So that might be an option. If you're just getting started, then you have a lot of good choices.
I see we're approaching 12:50. Just wanted to invite anyone who hasn't had an opportunity to answer their question to pop that into chat.
Well, this has been a really great opportunity, Diane. I wanted to really thank you for allowing us to show some of this work. If anyone has some feedback or some questions or some criticism, feel free to give us an email, and we'd be happy to discuss or touch base on a later date.
Great, thank you, Justin. I want to take this opportunity to thank Justin for orienting us to the CSM dashboard and to Tableau, and to thank all of the attendees for their participation at this afternoon's event. It's been a lively discussion, lots of interest in this in this initiative, so I want to thank everybody for their participation.